Hi, folks, and happy holidays. Not so much for public health officials, though, unfortunately, in Cobb County, as COVID cases continue to surge here, not only in Cobb, but in the state of Georgia and across the country. To get some perspective, as always, we went and talked to Dr. Janet Memark. She's the head of Cobb and Douglas Public Health, who told us that, unfortunately, we continue to set records.
Seems to be the kind of the same course that we've been having over the last few weeks, where cases have been going up extremely high, and the trajectory just does not seem to be bending at all. And so last night, we definitely had to let everybody know. We were at, when we did the case rate, it was 678 cases per 100,000 people with the antigens. And, you know, that is about 600 times higher than what high transmission would be. And so we're in some very extremely high transmission at this time in the community. And so we tried to get that message out to everybody as best that we could. So
what's fueling the latest surge here in Cobb and elsewhere? Well, cases across the country, Dr. Memark said, were already going up. And then here in Georgia, Thanksgiving hit.
I remember talking a few weeks ago, we talked about the national surge and how it was starting to gain steam. And we were not immune to that. We're a huge metro hub here, and cases started to rise here. And then we just threw Thanksgiving on top of that. And we have seen what was an expected surge of cases after that. And it could be, you know, the travel, it could be the weather on top of that. But now we're heading into another holiday when cases are so high that we're really just, you know, barely managing as a community to be able to keep up with this. And so we got to make sure that we get the message out to people that we got to go back to doing the preventative things that we need to do, because we know the vaccine's coming, but it won't be here for months for mass vaccination. So we got to do what we need to do, which is to continue with those masks and avoiding, I mean, I know it says less than 50, but I'm really advising people to avoid people that are outside their immediate families and do not gather. Please do not have any of these parties and gatherings outside of your own families.
One thing I've seen a lot on social media, maybe it's a strange way that some people have of trying to make people feel better about the pandemic, is the fact that death rates are not peaking along with the COVID cases. Well, Dr. Memark says that's because doctors are better at treating COVID. And the real impact, though, is that these COVID patients are going to the hospital, which means that hospital might not have room for you.
We've spoken about it earlier. The deaths will lag the cases in surge, right? So right now the hospitals are extremely full and busy. It's not just the COVID cases, but the COVID cases are definitely on the rise. Now, the beauty of having a pandemic this long is that our amazing doctors and healthcare workers have learned a lot about how to treat COVID-19. So, and we have a few therapeutics, treatments that have actually helped to decrease death and morbidity. So we're very lucky that the doctors are doing an amazing job of preventing people from dying, but that doesn't mean that they're doing really well. We have a lot of folks that are being hospitalized right now. So death rate will be lower because we have a lot of young people right now that are being infected, and the treatment has gotten better.
One issue that really peaks the meter is the effect of COVID-19 in schools. I think everybody, myself included, knows somebody who has a kid who's either been a close contact to somebody who's had COVID or has had COVID and then has the rest of the family quarantining as well. Well, the public health department, they can only give advice to the school district. They do not issue orders, and that's exactly what they've been doing.
So we communicate a lot with the school district and sharing with them information that comes into the health department. And so we work really collaboratively with them because they get a lot of cases that come in and get reported to them, and then we get a lot of cases reported to us. And the teams have to work extremely fast to be able to get the children, make sure they're not in school, and that their close contacts within the school are identified. And that is actually a very arduous process of identifying all those close contacts, especially when they switch classes multiple times a day. So we received, with the surge of cases, you might have remembered previously I've told you that we haven't had a lot of in-school transmission, like evidence of that, and we've been very fortunate. And I know that it's different in other places because, you know, we have mandatory mask policies in these schools, which have made it so that the transmission within the school is not as bad, right? But as the community cases continue to rise and rise and rise, the cases are being brought into the school. And so the number of cases that we were seeing were quickly overwhelming what was happening, the abilities of the school system and public health to be able to find those children quickly. And then going into the break, it was very difficult to find people once they took off for break. And so we wanted to make sure that we were able to get to a point where we can identify everybody that was a close contact and then get those cases out and wrap that investigation up so that we weren't having people going out and possibly infecting other people once they got out of the classrooms.
And a lot of parents are concerned about what happens moving forward when it comes to schools. And again, the public health department, all they can do is educate the school district and give advice.
So we don't have any magic answers on that, but if you think about it, it's kind of a pretty logical process, right? If we don't do something to be able to reverse the number of community cases that we have, we will continue to rise, and then you're going to put Christmas on top of that. And so we're trying to have the safest environment for children and teachers who are unbelievable, amazing to me that they have been able to work through all of this, right? But if it continues to rise, the environment will not be safe for them to be packed together like that. And so I'm praying that everybody hears these messages and they're able to reverse course and to be able to bring this back down again, because if we continue to go like this, we're all going to be in a lot of trouble.
And obviously, if you've been watching the news, you know about the light at the end of the tunnel. That's vaccines. They are coming. They're here now in the state of Georgia and soon to be in Cobb County as well. But Dr. Memark says what we've known all along. It's going to be quite a while before you and I are asked to roll up our sleeves.
It has been extremely involved and one of the fastest moving processes I've ever seen. The FDA approved that vaccine, and then within the next day they were mobilizing to get the vaccine out. Some of you may have heard that yesterday in Savannah we had 9 people vaccinated, and those are the first 9 people in Georgia. And so we're already hearing that our district is on the list and should very soon be getting some vaccinations. But there's a big but here. These vaccinations will be rolling out. The first batch is relatively small, and we have close to 790,000 people in our district. It's not approved for children under 16 yet, so that's one thing to know. And then it's approved for healthcare workers and nursing home residents at this time. And so as the vaccine rolls out and we get more and more allotments, we're preparing right now to vaccinate as many as we can under the tiers that come forward. But it is thought that the mass vaccination for the population will not be here for several more months. And so the trajectory that we're looking at, number of cases right now, if we continue to go this way, it's not sustainable. So we need to do what we can to slow it down.
So don't expect the vaccines to save the day in the near term. And then the question is, when will we know it's our turn?
If you go to our website, you will see a lot of the updated information as it comes out, and it comes out very quickly. We're hoping that we'll be able to let you know who has the vaccinations as they come out and who can vaccinate. So Cobb Douglas Public Health will always do some vaccinations, as many as we can, but the Wellstar Health System will also be helping to vaccinate the community as well. And so we talked about how this next tier is kind of a big tier after the healthcare workers and the nursing home residents. So we'll have a next really big tier with public safety, people over 65 with a medical condition, as well as having essential workers. So that's a really big group, and so we'll probably take a while to try to get through that group.
So once again, everybody wants to wish everybody a happy and peaceful and healthy holidays. Dr. Memark says she never dreamed that Christmas and New Year's would be right around the corner and we would still be talking about the coronavirus pandemic.
I was hoping that we would not be where we're at right now. As a public health official and a physician, it's very hard to watch as each of these surges and phases come through, and feeling I feel very helpless at times to be able to do anything about this. And so I come to you every couple of weeks and almost begging you to please to help us at this time. And so the cases are extremely high and on a trajectory where I'm sure that each of you knows somebody that has been affected by this. The hospitals are extremely full. And so, you know, this is a preventable thing right now. And so if we can do what we can do together, we have to be careful before this holiday push. And so we need to please wear your mask. Whenever you go out in public, do not gather with people that are outside of your immediate family. I'm sorry, but we really got to try not to have holiday parties and gatherings at this time. Keep your distance, even if there's a few people, keep your distance from folks, and wash your hands. But please remember, in these holidays, please do not travel if you can, and do not put other people at risk or your own families at risk. We need to be able to have some control or decrease in this as we head into the holidays, and then as we get these vaccines rolled out. So I ask for our community to come together to try to do this together.